This is a DNS transitional exercise going from 3-month supine to 6-month supine. 6-month supine in yoga would be happy baby for those that that makes a little more sense. So 3-month supine is our typical triple flexion, dead bug position, whatever you want to call it. If we're in typical, we would have arms down, triple flexion, ankle, knee, hip. Sometimes we have the knees slightly abducted to kind of offload the rotators of the hip. Now from here, we always want to make sure that we have an established punctum fixum or fixed point of around the TL junction. So that's here, and that's going to be really important for this transitional move. So from here, what are we trying to do? We're trying to go into lower lumbar flexion, L5-S1, L4, L5, using or utilizing the lower abdominal wall. So establish intra-abdominal pressure, maintain your hip flexion angle. What we'll see a lot of people do is try to pull their knees to their chest. What we want to do is leave our hands where they are, roll the lumbar spine into flexion, and then grab the toes, right? But we should be able to actively maintain this position and then control it back down. Let's show a bad rep. We may jump into it. We'll use momentum and catch, right? That's not a good control. And this is dynamic stabilization, right? So we're trying to move around and be stable at the same time and then controlling it down. The other thing, like I said, is I pull my knees up and try to grab my toes. So one more good rep. 3-month supine, deep neck flexion, TL junction's my fixed point, intra-abdominal pressure set. Nice, slow, controlled movement. Grab the toes if you need to, take a break. You can let your hips sink, go back down to 3-month supine, and that's our 3-month to 6-month supine transition.